I'm Clyde Stock.
And rumor has it one of you is an oral surgeon.
Yeah, we tried to be.
So you were an oral surgeon for how long?
30 years, 35 years.
And how did you find out? So how did you find out about Mr. Jason?
Our daughter worked for him.
And she highly recommended him. And tell me about because you're obviously very critical, I'm sure, of anyone that works on your teeth. Tell me just kind of about your initial experience with him, if you don't mind.
Well, we saw the quality of work he did and how he did it. And his ability to choose colors and shapes. And that was pretty impressive because you don't find that all the time. That's kind of a God-given gift. You don't learn it. You've either got it or you haven't got it.
Choosing colors and shapes. I mean, to me, it sounds like artistry would.
It is a form of art.
I mean, why is it so difficult?
Well, we're dealing with aesthetics and function. And to make those things blend is a real skill. Because not everybody can do that. And he seems to have that ability to bring the artsy side into the scientific side and make them blend to where people have a result that looks good and functions.
So what did he do? What did he need done, and what did he do for you?
Well, he did some implants for both Rhea and I, and then put crowns on those implants and made them look good and work good. Can't hardly beat that.
And how was your experience with Jason?
Mine was, I needed several implants. And our daughter, that's a dental hygienist, has worked in several offices. And when she came to work for Dr. Lewis, she would call us each night on the phone and tell us about the work he was doing. And she said, and he's painless. She said, you never feel anything. He's gentle. He's very personable. And she said, it's just a joy to work there and to see the people that come in to me for their prophies and to get the work done that I do, and then to see them a few months later after Dr. Lewis is finished with them. He said they don't even look like the same people, and even personality-wise. He said they come in very shy and they try to cover their mouth when they speak. They look at their feet, and she said by the time they leave, they're a whole different type of person. She said they walk in and flash a smile at you that you just have never seen before. And she's very, very observant of, you'll walk in and I'll say, what color eyes did they have, or what color, I have no idea. But Mom, you should have seen their teeth.
Right.
So we knew when, and she had probably worked for 15 other dentists before she worked for Dr. Lewis. And she said, I've never seen work like he does. So she was very impressed with him. And then he did some work for her. So when we needed something done, she brought us.
Is pain something you would get anxious about?
Well, if you're smart in this business, you understand something. You're treating fear and pain first. And anything that comes after that's footnotes. And so, if you don't understand that, you better go back to being carpenter or something. Because it's not going to work. And Dr. Lewis is good at that.
What does he do that's different?
He takes the time. First of all, the type of local injections he uses is state-of-the-art. He uses the wand instead of the syringe. Many times you don't even know when you've had the injections. And then he uses the sedation when necessary, to help people that are especially nervous, which cuts down on the need for the amount of anesthetic and time. He's observant to that. He likes what he does, and he does a good job of what he does.
So when you guys came, is there anything that was notable about the procedures you guys had done that you were impressed by in terms of the way you were treated when you came into place to the procedure?
Well, they're very cordial to us.
I was very impressed.
So,
I mean, you're treated like friends and family, and someone that that you feel very comfortable around them.
And this place is not too hard on the eyes.
No, not at all. Got a beautiful wife, and all the girls that work here are very attractive and very nice, very well mannered, and they enjoy what they're doing.
One of the
That's
things
number
that
one.
impressed me really, I was on the front end of this implant business. And it was a terrible experience and didn't work. And then when you find somebody that can do it as an afterthought and get the result that he does is absolutely amazing to me.
So what happened when it didn't work versus?
Well, years ago, we'd put all those in and they didn't work. You had to take them back out. And they were infected and a real mess to remove. And then you destroyed so much bone in the process with the infection and the trauma that it didn't leave a very good ridge to work with to have a good, decent result. And this way they avoid all that. Well, I used to put a metal rod up through here. I do it on the inside and made a bar across the bottom of the lower jaw. Then they had something to lock a denture to. And that worked, but the treatment was almost worse than the disease.
Yeah. So how does he do, like, what does he do that's different in terms of technology?
Well, they've got a very small implant that they put in, and the secret is to make them parallel and precise. Anybody can put them in almost, but to get them in the right position is the trick, and he does well at it. And it's pretty benign. It's not a big deal. You can go to the dance that night after you've done 2 or 3 of them. So.
That's amazing.
It is amazing.
Is there anything else that you can think of that you would like to say? Well, I guess we addressed anxiety, and is there anything else in general in terms of start to finish that you want to say about Jason?
He's not dully oriented. He doesn't diagnose you by the type of jewelry you wear. He's very fair and very honest in how he diagnoses you, and everybody gets the same. His best is what you get, and that's a very unique quality.
True. You have any final words?
So he's done, I think, 8 implants for me. And when I've left here, I've gone out for the evening, never had any pain or anything from it, and never discomfort. He always covers the area so you can eat or do anything you could before you came in. You're not left with a lot of pain and unable to do things socially or any other way. And in fact, one day he worked on me from 8 o'clock in the morning till 5 o'clock that night. I felt great when I left. Let somebody, I've had a lot of dental work done in my life, but never like he's done. I've worked for probably 15 to 20 years chairside with other dentists as he was going to school, and then I worked with him for 40 years after. So I've seen a lot of bad dentistry, and I've seen a lot of good, and then I saw Dr. Lewis's, and it was perfection. Like you say, it's an art. Anyone can learn how to just do things, but to do it with the art and the know-how and the color discernment that he has is just unreal.